guys, it's Dr. Nancy here, and it's a wonderful day because guess who I bumped into? The Zumbani guy. Note to self, you are not allowed to call him the Zumbani guy. I will let him introduce himself. Over to you.
Okay, welcome everyone. My name is Dr. Bhebhe. I'm a scientist, I'm a biochemist with a PhD in biochemistry. My main interest is on herbal medicine research. So I hope we're going to have a good, interesting conversation today.
So guys, now that we have Dr. Bhebhe here, not the Zumbani guy, Dr. Bhebhe, the Zumbani guy, but anyway.
It's interesting how you rub it in.
I mean, guys, it's a really interesting topic. I know in this pandemic that we are in, everybody wants to know about herbal medicine. I guess it's brought us to this interesting conversation about herbal medicines in our culture. I know we've all encountered herbal medicine at one point or the other. It might be Zumbani, it might be Makoni tea, it might be even our chimbache zingizi, as people call it when it comes to our gynecological products. So my question to you, Dr. Bhebhe, is where do you see us going with traditional medicine?
I think with the advent of this COVID-19 pandemic here in Zimbabwe, I think there is going to be an upsurge or increase in interest in herbal medicine because it's been like a whole year waiting for a vaccine from a conventional route, and people were waiting for so long and there was no solution coming in sight. Hence, we ended up turning to our natural remedies or herbal medicine. I think from this point going forward, already there was a steady increase in the past 10 years, but I think from this point going forward, I think we're going higher. And yeah, it's gonna be a bigger thing than it used to be back then.
Okay, my question to you is, I know guys, being Zimbabwean, you have probably encountered Tianji and Tens, and there's some, I don't know, so many herbal medicines that are around coming in from China and other African countries out there. What has stopped us to be able to take our traditional medication to the world, or even locally, for it to be able to be commercialized, sold to the people, and the people educated enough on the subject?
Okay, I think my answer might be a bit unconventional, but my observation has been religion has been one of the hindrances to taking traditional medicine, largely because the people who have been users of traditional medicines have been Nangas with a spiritual aspect which is anti-Christian, and we are largely a Christian community, so most of the people in our society, being Christian, did not subscribe to the use of traditional medicine because most of the traditional medicine that we're getting was being prescribed by non-Christian sources.
Okay.
That's why we are at this point in time. But in other countries which are non-Christian, I've seen there has been a good intake or assimilation of these kinds of products in a way.
Okay, I get your point, Dr. Bhebhe. My point is, as a doctor, I am always caught in between prescribing traditional medicine to the patient, because as a doctor, I'm always for a tried and tested method. I know there should be preclinical trials, phase 1, phase 2, phase 3. What is stopping scientists to be able to do all of these processes in order to enable people like me, medical doctors, pharmacists, physiotherapists, and all other health professionals in the sector, to be able to confidently prescribe this medication to the people?
I think it's been a long time coming. There have been scientists who've been scantily doing this kind of work, but it wasn't being done as wide or as large enough as it should be. To some extent, I think it has been the Christian aspect of traditional medicine being something that is not really up for use and favoring the conventional route. But I think to some extent the challenge has been the prioritization of our own indigenous sources. For the past 10 years, I've been working under mentors, a pharmacist who's also a toxicologist, Prof. Tagwire, and Prof. Muchiweti, who's a biochemist. They've been working hard. They are some of the few scientists in the country who've been trying to add value to indigenous knowledge systems. Ananyeve, Anaderere Munda, you know, they are even baobab as well. They were regarded as poor man's food. So their thrust, or the thrust of these scientists, they are not the only ones. There are several people who've been working on this, but there needs to be more. So these foods, our local foods, have been considered as poor man's food. So you can't bring a baobab fruit, chukoro, because it's like, who brings a baobab? An apple a day. They say an apple a day. An apple a day will keep you guys away.
What do you want the conversation to move for? Is a maroro or a tubu a day keeps the doctor away?
Exactly.
I don't know.
Exactly. That's where we're trying to drive it. Like a tubu or a baobab a day. Because if you look at baobab pulp, it's got 6 times more calcium than milk, or 10 times more vitamin C than an orange. You know, these are very rich plants which are indigenous to Zim and the region as well. But because we had oranges, apples, lychees, and those fancy fruits coming from wherever they came from, and we took them to a higher standard and looked down upon our own plants, largely because we didn't know what was in our own plants. So our local scientists, what we've been trying to do was to add value.
Okay.
Test these plants and then add value and try to make some noise. We've tried to make some noise to some extent, but somehow it hasn't been received that much. But I'm glad at this point where we are now with COVID-19 and these Zumbanis coming up, at least some sense of appreciation of our own local plants is coming up.
Okay. I do hear you that you've tried to make some noise about, try and educate people, raise awareness about all this. What do you think are the hurdles, per se, that you've been facing? Is it marketing? Is it a financial issue? Is it a matter of the information not being disseminated in quite the palatable aspect for people to be able to receive it? Because I have to be honest, as scientists,
Right.
we love peer-reviewed journals.
Right.
But I don't want to lie, nobody reads a peer-reviewed journal.
That's true.
Even when you were a student or doing your doctorate, you
Right.
only read peer-reviewed journals because you knew you were going to be asked about it. Do you feel that we should change the way this information is disseminated so that everybody at large is able to have all of this information at hand and be able to make an informed decision whether to take an orange, a baobab, a tubu, or a maroro or something? How do you think you guys can best package this information to be able to disseminate it to the people?
You know, that's a very interesting question. I think the biggest challenge has been working in silos. I'm a biochemist. I know lots of biochemistry. I can tell you a lot of things, cycles and stuff, chemical bonds and so forth. I know that stuff.
Yes.
But I'm not very good at marketing.
True.
I'm not very good at drawing a business plan. And also, I'm not an engineer who can design a machine that will process Zumbani in the proper way, or tuvu. I'm not even an agriculture scientist, because most of these local plants are indigenous fruits. They are seasonal. And for them to be viable business-wise, you need to have them growing throughout the year. Because a commercial person will then tell you, this does not make business sense, because if I'm going to harvest this in January, February, and then by March there's nothing. So what happens to my business in this plant? So we've been working in silos, but I'm glad to say that the current minister, Professor Murila, has been pushing for an agenda, education 5.0, where you, after having learned the academics, you found out tuvu and maroro and stuff, they are good at this, you need to take it to another level, you incubate it in an incubation hub, where you can link up with business people, you do the marketing research, you do all those kinds of things. And then after it's incubated, all those things have been verified, they've been experimented on, you then move that product into the industrial parks. Our universities didn't have an industrial park. We didn't have the business aspect of all the researches that we were doing in science. So I'm glad that our government or ministry is taking us in that direction. Even there is an element of innovation. There should be some courses on innovation and entrepreneurship for every student who's at a tertiary institution. I think we're heading in the right direction with regards to that. This is something that wasn't present for the longest time, which is probably why we are at this stage in time.
Okay, I think I definitely agree with you on that, because when I was in medical school, there is no business 101, eh? All they teach us is academia. It's never about how to run your practice, run your business. So I would like to say at this moment, anyone who's in marketing, business, investor, this is your moment for you to be able to support the innovative ideas that are coming in locally, to be able to support and give you input in, perpetuating the way that we perceive our natural foods and natural remedies, to be able to spread the word. Because to be honest, with people like Dr. Bhebhe, who will be able to understand our local products better and be able to benefit from them even more. My next question to you, Dr. Bhebhe, is how much is enough? Which is always a question to me as a doctor, because I know when I'm prescribing paracetamol, it's 1 gram of paracetamol 3 times a day, and there's so many lovely cycles and plateaus and all of that. Right. So my question is, when it comes to zumbani or baobab fruit or ntolwani, how much of it is enough?
Yeah, that's a very interesting question as well. I think with plants, it gets a little bit tricky with dosage, as you are rightfully saying. Because one plant, I would take zumbani in particular, because it's the wonder herb that is being taken by all Zimbabweans and people regionally. Each particular plant has 1,000, if not hundreds of thousands of chemicals in it that exist within it. And if you cannot quantify them, it becomes dicey for the consumer, because everything that you take in for medicinal purposes, even as food, may need to have a certain amount quantified of it. The reason why we need to do more work in coming up with quantities for certain products, let's say for zumbani, is that we need to have a uniform environment for zumbani to exist in or to be grown, so that it doesn't have certain chemicals that it produces to fight against the environmental pressures that it goes through. So if it's in a constant environment, we can then harvest it and then quantify what's there, how much of it is there, and how much does a person need for them to be healed or be saved, or how much can a person take in before it can start to be harmful. If you can't control the uniformity of the environment where the plant grows, the quantities of how much will always be a bit tricky. But it's always important to make sure you know at least how much a plant can give you. In the case of zumbani, again, sorry, I'll take longer and preach fine. The gospel of phytochemistry. True. So with these plants, you need to at least verify if it has a large margin of safety. For zumbani, in our research, we did an acute study, or to check if you take so much, like 10 times as much as a normal tea, will it even hurt or harm your liver cells or your kidneys? If you take zumbani in moderate amounts, like how people usually make tea bags, if you take that for a long time, the chronic study, does it even hurt you? So if both cases don't exhibit any harm, then the issues of how much lie bare, it's safe. It's regarded as a generally safe plant. Okay. But for plants like anandorani, which have more medicinal properties than nutritional properties, you need to then quantify, grow your ndorani in a uniform environment, so that you rule out all aspects of new chemicals being synthesized by the plant in an effort to fight either drought or pests that are coming in, because you can't account for those all the time. They come in as per exposure to the environment. So things like ndorani and these other medicinal plants may need to be grown in a uniform environment, and then you quantify the chemical, the bioactive compounds that you need for your therapeutic purposes.
I think my next question would be, are we making strides in extracting the key components in these plants for them to be able to be quantified and to be used in a medical setting? Because I know quinine, if I'm not mistaken, quinine started from a plant, and they were able to extract that which was in the plant that was curing malaria. Are we making strides towards doing that with our traditional herbal medication?
Yes, in the field of phytochemistry, so much has been done, but I feel so much could still be done. We have extracted chemicals, we have isolated a single bioactive compound, but here locally it's been slower than it should. But in the field where I usually play around, I've interacted with scientists in East Africa, South Africa next door, even outside in Europe and in the Orientals. People have been doing that. Yeah, it's been done, but I think there's still more that can be done.
I think the key that we're learning today is we are our own, what can I say? We are the people who are going to perpetuate progress as far as our traditional medication, remedies, and all of this Zumbani, Ntolwane, and everything else that comes in between. I would like to say, let's continue, this conversation and be able to continue thinking about innovative ways and supporting these innovative ways that we can possibly do.
Maybe just to add in something, I hope at some point we'll get to a point where traditional medicine, plant medicinal scientists and you guys, the doctors, can work hand in hand, like how they do it in India. In India, you can do a whole 5-year medical program where you are learning how to prescribe medication for someone who has an ailment using herbal medicine.
Oh yes, they call it Ayurveda?
Yes.
Yes.
And then there's also a whole full 5-year program where you can do the conventional route, which we are doing this end. I hope and wish that at some point here in Zimbabwe we'll have that standard after we have done most of the research and quantified the Ndoranes and so forth, because we have so many plants here in Zim that need to be explored and quantified, and we work with pharmacists and we make capsules that have quantities and so forth, and then we have both herbal medicine solutions and conventional medicine solutions in a way.
Yeah, I think everybody, the take-home message that I'm kind of seeing right now is we should all put our heads together to be able to find out more, because I don't want to lie, I would like to know what was in that little plant and stick that my grandmother used to make me chew when I go kwa one day, and it looked like my teeth looked whiter than when I used Colgate when I was back home. So that being said, guys, the conversation grows bigger to involve tertiary institutions, the ministry, everyone who's in each and every industry at large. Let's get involved and remember that your life matters all the time.
Yes, and currently MSU has been given the task to be the Center of Excellence in Herbal Medicine Research. UZ has been given the task to research and solve solutions with regards to small grains. Chinhoyi University has been given the task to do research on artificial insemination in livestock, and then NAST is doing something on genetic engineering. So universities have been tasked. Well, we are going somewhere. We're heading somewhere. I hope, as you are rightfully saying, let's team up and work towards having our own indigenous knowledge systems come up, and we solve our own solutions as universities, as scientists, and not work in silos as we've been in the past.
I will definitely come out of this conversation knowing a whole lot more than I did before. Thank you so much, Dr. Bhebhe, for joining us.
It was a pleasure. Thank you for having me. Thank you.
Thank you, everybody, for watching another episode of Pendulum in Conversation with Dr. Nancy. And remember that your life matters.
Without good health, you have nothing. So start your healthy journey today. Pendulum Pharmaceuticals. Your life matters.